All right. Hello, everybody. Today we are talking on the She Found Health Motherhood podcast all about constipation and hemorrhoids in pregnancy. Now, unfortunately, this is very common. So it's really important to know about what they are and how to manage them. And most of what we're talking about today is how you can manage them at home and when you want to talk to your care provider about it. Now, if you're not pregnant, stay tuned because this is an issue for many people, regardless if you're pregnant or not. There's a few added reasons in pregnancy why you might get constipated or might get hemorrhoids, but certainly the advice is the same whether or not you're pregnant. Before we get into that, I'm really excited to say that we are going to, as of today, July 22nd, when this podcast episode is airing, going to be opening up our pregnancy posse again for August. So we open up the doors for about a week to allow people to sign up and come in and test it out. You get a 7-day free trial if you sign up. And then we close those right before the next month starts. And that's because we kind of want people starting at the same time. We do a new member info intro. We kind of give people the plan for the month. So for instance, last month we did a talk on newborn sleep with a Q&A afterwards. We also had an amazing local lactation consultant and breastfeeding medicine specialist come in and talk about how to start your supply off right. And if you have supply problems later in your breastfeeding journey, how to work on those. We have a talk coming up about kind of navigating the relationship after having a new baby come home. And then we have an open forum Q&A with Dr. Sarah and myself. So that's kind of was last month's info. Next month, I know we're going to have a pelvic physio come and talk with us. And then before Dr. Sarah and I give our talks, we always do a poll out to our members to see what they're interested in chatting about. So we give 3 or 4 options, and whichever one gets the most votes, that is what we will chat about. We also have a couple of activities that we do, and we put together a prescription for health. So some ideas of what you can do during that month to kind of improve your health and well-being throughout your pregnancy. So that's a little bit about the pregnancy posse. We are still in the new phase of it. This will be in month number 2, so we're still trying to keep the costs a little bit low. So this month we're going to open it up for about $15 per month per member, and that's yours for as long as you want to stay a part of it. Last month was our founding member price, and so we're increasing it a little bit because we've learned some stuff and we have some good value added, and you have access to all of the old talks as well through our membership site. So we are opening that up today, July 22nd, for about 1 week, and then we'll be starting the next phase in early August. Okay, so if you want to join us, just check us out on our website at www.shefoundhealth.ca. All right, so let's get to it right after this quick reminder.
Welcome to the She Found Health podcast. We are Doctors Sarah and Alicia. We're maternity doctors who are passionate about caring for women and young families from conception through the first few challenging years of parenthood.
We have 5 kiddos between the 2 of us, so we get it. We've been there. And we made it through to the other side, and now we want to support you through your journey.
We are delving deep into topics to prepare you to have the healthiest pregnancy possible, the best birth you can, and to thrive rather than just survive during the newborn and postpartum phase.
We want to remind you that the information that we share is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. The information we share may not apply to every situation. If you have questions, or if you've received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition.
So first things first, we are going to talk about constipation in pregnancy. We're going to talk about what it is, why it's so much more common in pregnancy than in non-pregnancy. And we'll talk about some things that you can do about it at home if you're struggling with constipation, and when we want you to come and talk to us, your care provider, about it. Then we'll get into hemorrhoids, what can cause them, what are they, and how do we manage hemorrhoids. So first things first, constipation. So as anyone who has been pregnant can tell you, constipation is incredibly common in pregnancy, and your body changes so much with pregnancy. Your bowels are no exception. We think that about 1/3 of women suffer from constipation in each trimester. Now, it can come and go, but if you think about that, that is probably most women suffer from constipation at least some point during their pregnancy or their postpartum period, that 4th trimester. So that is a lot of women who are suffering with this. And this is compared to about 7% of women of the same age bracket who are not pregnant. So what is constipation? Constipation is generally described as the infrequent, like less than 3 times a week, passage of hard stool that's challenging to pass. We often describe this based on what we call a Bristol stool chart. This is kind of a picture of different consistencies of fecal matter. 1 is like little rabbit pellets. 4 is what a normal soft bowel movement would be, and 7 is like liquid diarrhea. So we call a 1 or 2, so rabbit pellets or clumped together rabbit pellets, that's kind of more like constipation. So if you get chronically backed up, so if you've been constipated for a while and you've never actually cleared it, you got stool backed up into your bowel, and at the top of that backup, there's kind of more liquidy stool that hasn't had a chance for the water to get pulled out of it. That will actually flow down your bowels past the constipated stool, and you can have what we call overflow diarrhea, which makes the whole problem even more confusing. How can I have constipation if I'm having diarrhea? Well, it's a thing, and it's actually really common in toddlers who are holding their poops in because they're afraid to have a poop. So oftentimes during the beginning of toilet training with toddlers, they get scared to have a poop, or they can't quite figure out how to do it, and they start holding their poop in. They get a bit constipated. It gets painful because it hurts when you have to push out a constipated poop, and then they hold more, and then they start to get diarrhea on top of it, and then the whole picture is just really confusing. So that is a thing, overflow diarrhea, when you are chronically constipated. So why is constipation so much more common in pregnancy? Well, the first reason, and definitely one of the most common in the first trimester, is progesterone. So we've talked about progesterone before. It is a pro-gestation, pro-pregnancy hormone, and it's really released quite significantly in that first trimester to support your pregnancy, but it's released throughout the pregnancy time, and it doesn't drop until we deliver that placenta at birth. So one of the many things that progesterone does is it causes abdominal bloating and constipation. And why is that? Because we think that it actually slows down the muscles around our small intestines that help push the fecal matter through. So this allows more time for the poop to be sitting there and getting the moisture pulled out of it. And it leaves the poop drier and harder to come out when it's that time. The slowing of the small bowel also means that we move things more slowly through them, and they just have a longer time to build up. So, for example, gas. Oftentimes, women in the first trimester really complain of having a lot of abdominal bloating, and that's because the gas isn't moving through their bowels as it normally would. So during the first trimester, our blood volume also naturally increases dramatically. So we suck whatever water we can out of anything to get it into our blood vessels. And so no exception to this is our poop. We are able to get some water out of our fecal matter through our small intestines. It gets absorbed, and we use it to increase our blood volume. But it can also contribute to constipation. And then what doesn't help during that time is often women are struggling with nausea and vomiting. So it's really hard to get a good amount of water in when you're having those symptoms of nausea and vomiting during that first trimester, which just adds to the problem. When we're pregnant, our babies use up our iron supply. So their only source of iron is us. And as a result, most women need to take an iron supply at some point during their pregnancy. And for anyone who's taken an iron supplement, most women, some women are lucky it doesn't, but most women can get a little bit constipated from it. So certainly there's some types of iron that are a little bit more effective and a little bit less aggravating on our stomachs. So ask your doctor or your midwife or obstetrician about that. But the other thing is most iron supplements, we can actually take every second day, and it's more effective as long as you take it 2 hours away from any calcium or dairy and with a little bit of vitamin C. So we've learned a little bit about what constipation is and why we get constipated. But what can we do about it? So we've got some great tips and tricks about how you can help constipation at home. So what do we need to do? Well, we need to understand why we get constipated to help figure out how to help it. So we've already talked about that. So the first tip is stay well hydrated. Drink lots of water. And if you're nauseous, drinking a lot of water at once is not going to go well. But if you're able to take small sips frequently throughout the day, you should get enough water in you throughout the day. And now oftentimes there's a question of, well, how much water do I need to drink? We don't need to measure it in cups. What you need to do is drink to thirst. So if you're thirsty, drink until that thirst is quenched. And then keep doing that throughout the day, and you should get enough water just by listening to your body throughout the day. The next one is, how do we get our bowel muscles actually working more effectively? And we can do this in a couple of ways. So movement helps. Movement helps get your bowels moving appropriately. So get out walking every day. This will help your bowels to be more effective in their function. The other thing that can help your bowels is caffeine. So some people really notice that when they have a cup of coffee in the morning, it gets their bowels going, and that's the time they have their morning constitution. So if that's you, having a cup or two max of coffee or tea in the morning is totally fine to get your bowels and keep your bowels nice and soft. Other people notice it doesn't help, so don't use it just to keep your bowels going, but if that's a nice side effect for you, that's wonderful. The third thing we need to do is soften up your stools. So that sounds easy, right? Well, it actually is. We use fiber to bulk up our stools and to pull water into them so that they're softer and easier to pass. This should be the mainstay treatment for anyone with constipation. Now, you have to be doing number one, so you have to be getting enough liquid in your diet every day to allow that water to be pulled into your stools once you're bulking it up with fiber. The other thing we do is we need to actually make sure that we're getting enough fiber, and a lot of people aren't. So what are we talking about with good amounts of fiber? Well, food can be a great source of fiber, and some high fiber options for food is beans, fruits and veggies, whole grain cereals, and bran. So bran buds are a great way to do this. But despite most people's best efforts, they need more help than this. And so then we recommend taking a fiber supplement. So psyllium fiber is what we use, and Metamucil is a quick and easy one. So you just get your Metamucil, you put in a big glass of water at the beginning of the day, and you drink it. So that does two things. One, you're getting some good hydration in there, and two, you're getting your fiber in for the day. So we've talked about some things that you can put into your body and do to your body to help get your bowels moving. But let's talk a little bit about how to poop. Now, let me tell you, all of you pregnant people out there, take note here, because how we poop is also how we push at delivery. So you can have mini practice sessions all the time if you are conscious about it when you're pregnant. So first things first, when you need to have a bowel movement, go ahead and have a poop. When you need to poo, have a poo. Please do not hold it in. Obviously, once in a while you're going to need to because you're just not in an area that's appropriate. But generally speaking, try to have your bowel movement when you feel the urge to. When you are having a bowel movement, you want to sit with your knees higher than your hips. So there's actually footstools out there made for this specific purpose, but it doesn't matter if you have what you have. Just use something. You could use a couple of bricks or some blocks of wood or a little stool to get your feet higher up your hips, to get your knees higher up than your hips. And then you want to lean forward and put your elbows on your knees. You want to relax and kind of let your stomach relax. You don't want to be sucking your stomach in, but you also don't want to be pushing it out. And then you're going to straighten your spine. So you don't want to be bending forward and you don't want to be arching your spine. Having a nice straight spine keeps everything nice and aligned inside. So now, here for the pushing part. This is the part you're going to practice for labor. And we actually talk about how to push in our online prenatal course. It's the masterclass for labor and delivery, an insider's view. You can get it on our website at www.shefoundhealth.ca. We have a segment in it about how to push and the evidence behind it. But here's a sneak peek for you. So, number one, take a deep breath and fill the bottom of your lungs. You want to keep your mouth open and you want to relax your pelvic floor and anal sphincter. Then you want to use that deep breath to really help push down while bracing, but not really tightening your abdominal muscles. Some people find making a little bit of a noise, or a grr or a moo sound, really useful to help from putting up too much pressure on the pelvic floor. So this is what we call open glottis pushing. So you're not going to close your mouth. You're not using all that force down into your pelvic floor. You're just using some of it. And you're going to do this, 2 or 3 times. If by the third time you actually haven't started having a bowel movement, maybe it's not actually time for you to do it. We don't want you pushing too much on your pelvic floor. So if you've tried a few times, not successful, up you get, walk around, have a big glass of water, and try again later. Now, this part you cannot do in labor. Generally speaking, once you're fully dilated and you have that urge to push, you just got to go through with it. But when you're dropping the kids off at the pool, you can always try again later if it's not successful the first time. So like I said, if you've been kind of sitting there for a couple of minutes, you've tried a few pushes and you just can't have your bowel movement, then please get up and try again later. Straining for longer periods can really increase your risk of hemorrhoids. And it can also stretch out your pelvic floor. And the other piece about that is when you're done having a bowel movement, get up. Don't sit and scroll through Instagram. Don't read a book on the toilet. When you're done using the toilet for what it's for, please get up and go on your way. If not, you can increase your risk of getting hemorrhoids. If you do have hemorrhoids and you have had a successful number 2, when you are wiping, please just dab your bottom. Don't wipe. Don't try and get in there. Just dabbing your bottom with toilet paper, or even using a bidet if you've got one to clean yourself, is the gentlest way of managing your hemorrhoids. And I know I shouldn't have to say this, but please, please, please wash your hands afterwards, folks. So if you've done all of those pieces of advice, you've added in water, you've added in fiber, you're moving daily, you're using proper pooping technique, and you're still suffering, many of us recommend something called PEG, or it's also known as Restore-Lax or Laxaday, to help get your bowels going. So it's totally safe in pregnancy and you can buy it at the pharmacy. But if you're suffering from constipation and it's ongoing, we want to know about it. So talk to us about it. We need to make sure there's nothing else going on. And some people have other ideas about how to manage constipation as well. So certainly if you're suffering, please talk to your care provider about it. This is bread and butter for those of us who do maternity care or family practice. We hear about this all the time. So please don't be embarrassed about it. So we've chatted about constipation, and as you kind of heard, that can lead to hemorrhoids. So what are hemorrhoids? Hemorrhoids are outpouching of veins in the anal canal. Generally speaking, these are caused by increased pressure in the abdomen or pelvis from a variety of sources. These sources can include straining to have a bowel movement when constipated, obesity, and of course pregnancy. So especially as your uterus grows and it puts more pressures on the veins that act to return blood from the lower half of the body back to the heart. How common are hemorrhoids? Well, we think that like 30 to 40% of women suffer from hemorrhoids at some point during their pregnancy or postpartum period. That's a lot of people. And I can tell you, most people don't want to talk about it. So super common. Please be aware of that. And please know that we talk about this stuff all the time. There is no need to be embarrassed about it. If you're suffering, please come and talk to us. So what are the symptoms of hemorrhoids? Well, many women don't even know that they have hemorrhoids. But certainly the symptoms that some people experience are itching, pain, and bleeding. And then some people can also feel a small lump in their rectal or anal area as well. What can we do to treat hemorrhoids? Well, I'm sure you can figure this out, but since one of the reasons that people get hemorrhoids is straining and constipation, we need to treat the constipation. So how do we do that? Well, again, hydration, activity, fiber, proper pooping technique, and then if we need to, some medications we can help with. We can also just manage the discomfort of the hemorrhoid by using some creams and ointments. There's also kind of suppositories that you can use with similar type of medication, or pads that you can use, so tuck pads or witch hazel pads that can help relieve some of the swelling, some of the inflammation, and some of the discomfort associated with hemorrhoids. So because some of the symptoms of hemorrhoids, bleeding, itching, pain, can also be associated with other things in that area, we want to make sure that it's actually hemorrhoids that we're dealing with. So again, if you're having symptoms, if they're bothering you, please mention them to your care provider. Most likely your care provider will have a quick look and say, yeah, no, it looks like hemorrhoids. Here are some things that you can do. But every once in a while, it's something else. And we need to make sure that we are catching those other things because the treatments can be different and we don't want you suffering for longer than you need to be. So in terms of hemorrhoids in pregnancy, because the uterus is no longer causing a lot of pressure once the baby is out, most hemorrhoids actually resolve after pregnancy, as long as we maintain our soft bowel movements going forward. So they can recur if we have another time in our lives when we have increased pressure in our abdomen. So if we get constipated, if we get pregnant again, and a few other reasons. But most of the time, if we're able to keep our bowels nice and soft, the hemorrhoids won't come back. We're always at risk of it once you get hemorrhoids, but generally speaking, if we can keep our bowels under control, usually we can keep our hemorrhoids under control. If, for whatever reason, hemorrhoids don't improve after pregnancy and with good maintenance of bowel habits, there can be a role for surgery, but this is generally the last resort. So let's recap. Number 1, constipation and hemorrhoids are very common in pregnancy and are managed in similar ways. Number 1, hydration. Drink to thirst. Number 2, movement. Stay active in your pregnancy. Number 3, fiber, fiber, fiber. If you struggle to get enough in your diet, then add in some extra with bran buds or Metamucil. But remember, these both act by pulling water into your stools, so if you're not staying hydrated, they are not going to help. Number 4, if you are suffering from constipation or hemorrhoids, please, please, please talk to your care provider because we can help. So that wraps up our chat about constipation and hemorrhoids. Really hope that was useful. We really appreciate if you like this content, you subscribe wherever you're listening to and leave us a 5-star rating. It means that both other people will get access to the podcast and learn the same, but it also inspires us to keep going. So if you like what you've been getting out of these podcasts, head over to iTunes and leave us a 5-star review, and I really hope you enjoy them. So check out our website, www.shefoundhealth.ca. We've got both of our online prenatal class there, and if it's the right time of the month, the pregnancy posse for you to sign up. Remember, you get 7-day free trial, so if you don't like it, you don't have to keep accessing it. And if you do like it, then you'll get that price for ongoing. So hope you have a lovely day and keep your bowels nice and soft.